Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. New guideline by ASA. Preventing a first stroke may be possible with screening lifestyle changes. The 2024 guideline for the primary prevention of stroke replaces the 2014 version and is a resource for clinicians in implementing a variety of prevention strategies for individuals with no prior history of stroke. The new guideline provides evidence-based recommendations for strategies to support brain health and prevent stroke throughout a person's lifespan by improving healthy lifestyle behaviors and getting preventive care. The new clinical guideline from the American Stroke Association, a division of the American Heart Association, was published in the association's journal Stroke. Top 10 take-home messages. Number 1. From birth to old age, every person should have access to and regular visits with a primary care health professional to identify and achieve opportunities to promote brain health. Number 2. Screening for and addressing adverse social determinants of health are important in the approach to prevention of incident strokes. This updated guideline includes an orientation to social determinants of health, acknowledging its impact on access to care and treatments of stroke risk factors. Therefore, screening for social determinants of health is recommended in care settings where at-risk stroke patients may be evaluated with the acknowledgement that evidence-based interventions to address adverse social determinants of health are evolving. Number 3. The Mediterranean diet is a dietary pattern that has been shown to reduce the risk of stroke, especially when supplemented with nuts and olive oil. However, low-fat diets have had little impact on reducing the risk. This guideline recommends that adults with no prior cardiovascular disease and those with high or intermediate risk adhere to the Mediterranean diet. Number 4. Physical activity is essential for cardiovascular health and stroke risk reduction. This guideline includes a summary of high-quality data showing that prolonged sedentary behavior during waking hours is associated with an increased risk of stroke. Therefore, we provide a new recommendation for screening for sedentary behavior and counseling patients to avoid being sedentary, as well as a call for new studies of interventions to disrupt sedentary behavior. This is an addition to the recommendation to engage in regular, moderate to vigorous physical activity. Number 5. Glucagon-like protein 1 receptor agonists have been shown to be effective not only for improving management of type 2 diabetes but also for weight loss and lowering the risk of cardiovascular disease and stroke. On the basis of these robust data, we provide a new recommendation for the use of these drugs in patients with diabetes and high cardiovascular risk or established cardiovascular diseases. Number 6. Blood pressure management is critical for stroke prevention. Randomized controlled trials have demonstrated that treatment with one antihypertensive medication is effective for reaching the blood pressure goal in only around 30% of participants, and that the majority of participants achieve the goal with 2 or 3 medications. Therefore, equal to or more than 2 antihypertensive medications are recommended for primary stroke prevention in most patients who require pharmacological treatment of hypertension. Number 7. Antiplatelet therapy is recommended for patients with antiphospholipid syndrome or systemic lupus erythematosus without a history of stroke or unprovoked venous thromboembolism to prevent stroke. Patients with antiphospholipid syndrome who have had a prior unprovoked venous thrombosis likely benefit from vitamin K antagonist therapy over direct oral anticoagulants. Number 8. Prevention of pregnancy-related stroke can be achieved primarily through management of hypertension. Treatment of verified systolic blood pressure of more than or equal to 160 mm of Hg or diastolic blood pressure of more than or equal to 110 mm Hg during pregnancy and within 6 weeks postpartum is recommended to reduce the risk of fatal maternal intracerebral hemorrhage. In addition, adverse pregnancy outcomes are common and are associated with chronic hypertension and an elevated stroke risk later in life. Therefore, screening for these pregnancy outcomes is recommended to evaluate for and manage vascular risk factors, and a screening tool is included to assist with screening in clinical practice. Number 9. Endometriosis, premature ovarian failure and early onset menopause are all associated with an increased risk for stroke. Therefore, screening for all 3 of these conditions is a reasonable step in the evaluation and management of vascular risk factors in these individuals to reduce stroke risk. Number 10. Understanding transgender health is essential to truly inclusive clinical practice. Transgender women taking estrogens for gender affirmation have been identified as having an increased risk for stroke. Therefore, evaluation and modification of risk factors could be beneficial for stroke risk reduction in this population. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.